Thank you very much, Uma. And it's clearly an impressive body of work. If I may, I'd like to dig in a little bit deeper to some of the things you said that were crucial, clearly, to your project. And one of the things you mentioned, Uma, was creating trust. And I agree that creating trust is absolutely a foundation, I think, for really effective patient and public involvement. But I always think that involves developing relationships with people over a period of time, I think. And there's a lot of time and effort, I think, goes into that. Could you tell us a little bit more about what you did to develop that trust? Because we know that doesn't just happen overnight, does it?
Yeah. So thanks, Gary. Initial way that we try to create trust is to work with the organizations, and we never really got to communicate with the deaf people. I realized the best way is to work to get someone who had lived experience, someone who has lived experience, a deaf person in this case, and this deaf person would create trust with his community. So we work. So he is in this case, it was Anthony and Jennifer, who are researchers, and they created the trust. So through them, we build this experience. So it is actually it was not indirect because Anthony and Jennifer were part of the group. So they needed to build trust with the community. They understand the issues that the deaf people face. So that is the kind of trust that we needed. It's different in other communities where you go and do some work with them because you don't understand their language. Unless I could speak, I have to say I don't know sign language very well. So they don't trust you as much. You need to be able to communicate with them in that way. So that's the
Mm.
trust I talked about.
Yeah.
Yeah.
And I suppose it's about building time into the projects, isn't it? To have those conversations, have those meetings where you develop trust. I guess one of the struggles always is justifying that to your managers, to your funders, that we're not just going out
Correct.
drinking cups of tea, etc. That or we might be, but that's a really important part of the process, developing that trust. And that can't always be measured, can it? But it has to be valued in some way.
Exactly. So it took us more than five to six, I would say now 7 years now to get to where we are.
Wow.
So of course, like I said, that 1 year of research, or it was more than a year of research, has just gone down the drains because we didn't do this initially. We learned it the hard way.
And does your project funders, your employers, do they allow for that and encourage that, or do they question it?
I will thank God that was a very small funding from my university.
Mm.
So we did tell them that we weren't confident enough to publish this kind of work. So that's something. Yeah, it was a small grant, but ethically it was not right to publish it. So they
Fantastic,
understood.
thank you.
Yeah.
Another question I have, and again, I agree with this totally. You said about involvement at every stage of the project. How much support and training did you need to give people, though, to enable them to take part in every stage of the project? Because I often think that sometimes in patient public involvement, we almost parachute members of the public into a research situation and somehow expect people to perform with very little context. And actually, sometimes people need a little bit of training and support to enable them to contribute effectively. So I wonder if you could say something about what you did in terms of training and support.
Um, it's still a challenge for us doing that. For example, we what we do initially was to identify crucial people who we can train. So these crucial people will need to have a certain level of understanding to do that. So we only can work with a small number of people. We hope that we can get more people involved, more people trained to to help us with this involvement. But at the moment, it's just a group of crucial people who we identify and we work with them. And so we choose who we can specifically train who have the level of understanding. Yes, I agree with you. It takes a lot of time and a lot of effort because at the end of the day, we are researchers and we want to get it published. We must make sure that it's done properly as well. It's still a huge challenge along the way. Yeah.
Cool. I'd also like to ask Uma, thank you for that, about you said about no imbalance of power. And again, I think those of us in the patient public involvement world, that's something that we often struggle with.
Mhm.
Uh, um, and you mentioned, and I think quite rightly, that sometimes people can be quite intimidated if they're thrust into an environment where there's professors, senior clinicians, etc. We invite them into our university buildings and hospitals, etc. And they can be quite intimidating. And I know you mentioned about having events in culturally sensitive places, but could you say something a bit more about how you reduced that intimidation, if you like, and how you created an environment where there wasn't an imbalance of power?
Okay. For instance, there was one project where we needed to get feedback from the deaf community, sign language interpreters, as well as the medical healthcare practitioners. And one session, we needed to get all three involved together. Um, we were wondering, when we have all three groups together, definitely the deaf people will be intimidated. They won't talk as much as the healthcare practitioners. So what we did was we actually briefed the healthcare practitioners, and we had a very good facilitator to ensure that facilitation is done in such a way that you don't have one group over talking the others. And, so there are a couple of ground rules to be set as well. Um, so, a deaf person, you can't crosstalk as well. So we had a lot of ground rules set before these things were done. We briefed the participants that it's important to, if you want to talk, raise your hand. You have to be careful about the other person. That's some of the things that we did, to ensure that there is. It's all the time. Even when we have meetings on Zoom with a deaf person, sometimes you have someone who comes in and who does not follow these rules. So before we start, we always have these ground rules. You need to follow these ground rules. Yeah.
Thank you. It's something actually I do as well, Uma. I have a ways of working document that I call it with all the similar things that you said. We've got some questions coming in. Just bear with me, Uma. This one's from Kate Hu. Thanks for a great talk. Have you done any research to determine the impact of all the great work you did for the project, such as whether there's an increase in health literacy amongst the deaf people who've used the app, or better health outcomes following an increase in sign language interpreter use? And if so, how have you done this? How have you collected that impact?
Okay. Thank you for the question. The app is not currently in use. We are at the stage of carrying out a couple of um, tests of using. Well, the moment we're planning to use it as a web application. We are planning to run a couple of tests on clinical trial on site at a couple of hospitals before it is rolled out. That's about the app. Whether we have done any health literacy, we don't have. We have actually submitted a grant to carry out, look at the health literacy of the Malaysian deaf community. We do have intentions of carrying out to look at health outcomes of the people after using the app once we do a trial in the clinical setting. Yes, we do have plans to do it, and definitely those things will be published once that's carried out. I hope that answers your question.
I was on mute there, Uma. Yes, that does. Fantastic. And thank you for the answer. And thank you, Kate, for the question. A question here from Katie Porter. Fascinating account and clearly a learning journey for all concerned. Uma, if you had known at the start what you now know now, what might you have done differently?
Learned and mastered the sign language, the Malaysian sign language, which I'm still learning. It's not easy. That's one. And I would have actually got hold of more deaf, or rather, get more deaf people, students to do their undergrad degree, masters, and PhDs. We do have a lot of, in Malaysia, we do have a lot of them who have their basic degrees, but not masters and PhDs. So that's something that I'm beginning to do only now. I should have started that much earlier.
Brilliant. Fantastic. Thank you very much. I've got one last question. Can you just tell us something about your future work in this area, Uma, and what your plans are?
Oh God, I got so many ideas, so many things that we want to do. I get I don't know if Anthony is here, but one of the things he says is that's a huge mental health issue with the deaf people, and so we'd like to train a couple of deaf leaders on mental health first aid. We'd like to train healthcare practitioners since I work in the medical school, and I think we need to add a little bit into their curriculum about deaf culture, how you do the do's and don'ts when you have a deaf patient. And the other thing is that there are a lot of medical terms that we don't have sign words for them. So we'd like to develop medical sign banks. So there's so many things that we'd love to do, and we have applied for grants for some of them, and just waiting to see that materialize, and hope we can do that in the next couple of years.
Thank you, Uma. Actually, that question was from Jeremy, not from Katie Porter, but it's come up Katie Porter on my screen. But I've got another question here from Yangu, and thank you for the great talk. And may I ask how you reached children and/or adolescents?
Oh God. We've not looked at children at all. We've not looked at children at all. Yeah, that's definitely another aspect. I think in Malaysia, when it comes to children, it's more of deaf education, the kind of support they have in schools, in specialized schools. So yeah, that's something young that we have not looked at. Well, my concern is mostly healthcare issues, so healthcare access issues. So if you are a child, you'll probably be dependent on your parent, for healthcare access. So yeah, that's huge amount of work there. Not gone there yet.